Professor Nick Maynard. He is a consultant surgeon at Oxford University Hospitals NHS Foundation Trust. He's also a regular visitor to Gaza with medical aid for Palestinians. Doctor, it's a pleasure. Thank you for joining us here on Just 2 Degrees. Let me just first draw our audience's attention to a tweet you posted a while ago in the last 12 or 13 hours about the situation in Al Shifa. You said you worked there in Gaza back in 2014, and you can assure the world that there is nothing beneath Al Shifa that even resembles tunnels or a command center. What are your comments on these latest raids by the Israeli army?
So that's not actually correct what I said. I made it clear that I have no knowledge of the tunnels at all. What I stated was that on the multiple visits to Al Shifa Hospital in the last 15 years, I have seen no evidence of any Hamas in the hospital itself. And more importantly, those of my friends and colleagues who've been working in Shifa for 10 years or so, and for the last 5 weeks have been living there 24 hours a day, have not seen any evidence of Hamas soldiers in the hospital itself. There has never been any restriction of movement around the hospital. So I have seen no credible evidence at all that Hamas military have been in Shifa Hospital at all. What I cannot comment on is what has been going on in the tunnels underneath, because I have no knowledge of them.
All right, understood. Doctor, are you in contact with any doctors in Gaza? If so, how are they describing the situation today?
I am in contact daily with doctors in Gaza. I haven't been able to talk to any of my contacts in Shifa Hospital for the last 2 days, which of course is very worrying in its own right. But I have spoken yesterday to a Gazan doctor who is outside Shifa but has been in contact with doctors there. And the situation in Al Shifa Hospital is absolutely desperate. There are about 500 patients, I understand, left in Al Shifa Hospital, and about 100 doctors. And they are not able to treat any of these patients adequately. There are about 60 patients who are in kidney failure who require regular dialysis. They're not getting dialysis, so they will all be slowly dying of their kidney failure. We've all seen the pictures of the newborn babies who need incubators, and there are many patients also on ventilators in the intensive care unit who cannot be ventilated because of the lack of any fuel or electricity.
I think you pretty much answered my next question to you, which would be about the immediate medical needs of people there once medical teams were able to reach Gaza. Can you confirm whether or not you were there in Gaza at the start of this recent conflict? Were you, and if you were, what did you see when you were there?
So I was last in Gaza in May of this year, so I wasn't there at the beginning of this conflict, but I was there in May when the last major bombardment from the Israeli Defense Force took place. And I was stuck in Gaza for a week with the borders closed, the country in lockdown, in the middle of incessant bombing from Israel and, of course, rockets going from Gaza into Israel. I was eventually evacuated by the United Nations. I was meant to be going into Gaza on October the 20th for a week of surgery that I was planning to do with a colleague of mine. I'm a cancer surgeon, and we are in the process of helping the Gazan healthcare system improve their cancer surgery services. So I was meant to be there on October the 20th and for a week, and I was meant to be going out again last week, and obviously have not been able to get out there.
Right, thanks for clarifying when you were last there. Doctor, a doctor in Gaza said, quote, patients in the intensive care departments and the newborn babies are currently facing a very high risk, and a lot of them have been martyred in the last few days, and a lot of them are under risk and facing death today and in the upcoming days. Based on your contact with doctors there, is that the genuine expectation on the ground?
It most certainly is. Many of these patients have already died in the last 2 or 3 days in Al Shifa Hospital. Patients requiring ventilators to keep them alive can no longer be ventilated, and many of them have already died. I think unless there is a very, very rapid change in the situation, our expectation is that all those patients will die.
All right, Dr. Nick Maynard, we really appreciate you taking time to speak with us. Thank you so much for your time.
Thank you very much for asking me.